Und unser nächster Beitrag und der darauffolgende Talk finden auf Englisch statt. So let's switch to English. I'm delighted to welcome Dr. Samira Asma at ESRI Conference 2021. She's Assistant Director General for Data Analytics and Delivery at the World Health Organization. Dr. Asma, welcome. It's a pleasure and an honor to have you at our event.
Thanks on behalf of the World Health Organization and to the entire ESRI community for stepping up and supporting with the tools that the GIS has to offer through ESRI, especially at such a critical time in our lives. So thank you so much and happy to be here.
Thank you. We're very, very much looking forward to your talk.
So shall I begin?
Yes, please.
To share some of my impressions. I would like to begin by thanking Jack Dangamond for his visionary leadership when he planted the whole idea of using GIS technology in public health, and it has truly saved many lives. COVID indeed is an important reminder that unless we leverage the tools, the technology, and the partnerships to address the significant gaps and fix the systems now, we will otherwise not be able to achieve the 2030 targets, let alone get back on track and build resilient systems and a resilient planet, so that when there is another emergency, we should be able to surge the capacity and respond in a more adequate manner. Very soon, tragically, we will reach the 5 million mark of lives lost due to COVID-19. And as everyone recognizes, this 5 million is a significant undercount, because not all is good in the world of data. Lot is incorrect, lot is unknown. It is because we don't have the ability to accurately track the lives, the births, the deaths, and everything in between. We are relying on guesstimates and estimates to take a true number of the tragic human toll and the lives lost due to the pandemic. Just last year, WHO reported that we had at least a 1.2 million undercount of deaths that compared to what is officially reported from the countries to the World Health Organization. It is because the systems are weak, often weak, and there are no good systems to report in a very robust manner. And that truly limits government's ability to respond adequately and direct the limited resources to where it is needed most. WHO did an assessment, the first assessment that was undertaken 2 years ago, to understand where every country is with regards to its data and health information system capacity. You will be shocked to learn that 4 out of 10 deaths are unregistered. And when we look at Africa as a continent, 9 out of 10 deaths are unregistered. That means it is very difficult for countries to not only know about deaths, but cause of death, which is very important. And it is very relevant now because there is a confusion or lack of understanding in terms of how many people truly died as a result, as a direct result of COVID-19 or as an indirect result due to the pandemic. So this is very important and it is very serious. But we also have the solutions in our hand. For example, the whole GIS technology was very instrumental in polio eradication efforts. Just 40 years ago, not far away, polio claimed around 350,000 people in Africa. And GIS played a very critical role in eradication in the continent. And just last year, polio was eradicated in Africa. And we are at the last mile in 2 countries, in Afghanistan and Pakistan, where polio cases are reported. GIS has also been very instrumental in our response to the Ebola epidemic, and it has been also vital in responding to other emergencies. Not only for health emergencies, but now is the time for the whole global community to look up to this resource. I would like to say that GIS should become a universal solution to tackle public health problems. And the entire health sector influences all of the sustainable development goals. It has been very prominent now, and COVID has truly underscored that. So where else can GIS support beyond health emergencies? In the supply and the logistics, and especially in hard to reach populations. We are using GIS technology for microplanning as the COVID vaccines are being deployed. So these are very promising improvements that we are seeing. One exciting area that we just used as an example and demonstrated how the power of GIS could truly address a neglected tropical disease. In Europe, we might not hear very much about snake bites, but snake bite is a neglected public health problem. Every 5 minutes, at least 50 people are bitten by a snake. And 25 people need an antivenom. If they don't get that antivenom, 4 people will be permanently disabled, and at least 1 person will die. This is every 5 minutes. And it may seem nominal, but it is not. Because it can truly, through the use of connecting through technology means, we can truly save lives and bring the solutions to where the needs are the greatest. So last month, along with many partners and bright minds, WHO launched a snake bite information and data platform. This is just to demonstrate how a challenge can be solved using partnerships and different technology points. And we come up with a solution, and we did with regard to the snake bite. Using ArcGIS technology, this platform brought together many global experts, including researchers, GIS specialists, data scientists, cartographers, herpetologists, those that specializes in snakes, and more crucially, citizens. So the idea was to take pictures of the snakes, identify and sort which are the snakes that are most venomous, create a library of pictures, and identify the venom and the antivenom and the facilities that host the antivenom, and how a victim, when bitten by a snake, can rapidly go and get the antivenom care at a nearest health facility. And this is all happening by connecting the technology dots. So this is to say that WHO is truly unleashing the potential of GIS technology, and it is saving lives. And as we go forward, again, through the partnerships, through the European network, as well as the global ESRI network, we are proud to say that this is the first time I'm saying at this conference that WHO will be launching a GIS Center for Health, which will focus on country capacity and building partnerships and infrastructure so that every country will have the resources and robust data and health information systems to tackle any public health crisis in a very efficient manner. We are very thrilled about this announcement, and we would not have been able to do this without the solid partnerships that ESRI has been offering us. This will truly connect maps, technology, data, and people, and it will truly be dedicated to bringing in networks so that we can align ourselves in supporting the countries. And here, I would like to acknowledge one of my colleagues who is very passionate, and his team, Ravi Shankar, who you may have known and worked with, and his team who has been working to create the networks and partnerships with you to launch this center next month at the Global ESRI conference. Finally, I would like to close by saying that no one institution, no one individual, or no one country can solve local as well as global crises or problems in isolation. We must come together. As I often say, that 1 + 1 can be 2, but 1 + 1 can also become 11. And that is truly the power of partnership. And I truly look forward to working more deeply with the ESRI community. Thanks to you, and back to you.